my notes are already written and stuff.
And then you can go out every night you want.
Yeah. I can work as much as I want because I won't have to stay.
So welcome everyone. For all of those who are joining us, I'm Dr. Amiee, and we also have Anna Baker here. Anna, are you on the call? For any newcomers that we have, if I could ask you to please mute your microphones and turn off your cameras. And we shall be starting the webinar on understanding how stress affects the skin just shortly. Great, so let's start the webinar for today. As I said before, I'm Dr. Amiee. We also have my esteemed colleague Anna Baker as a voice call on this webinar. Anna is a very experienced aesthetic nurse, and she always shares lots of interesting evidence-based insights on anything to do with skin. And I will be here today telling you how we can really put some of these things into practice and help our patients treat their skin when it is being affected by stress. So this webinar today has been brought to you by AestheticSource. We have Nikki and Vicky from AestheticSource who are looking at all of your questions. So if you'd like to put any questions you have in the little chat box at the bottom of the screen. And thank you very much for your time today. I'm going to just hand over to Anna.
Thank you, Amiee, and really to reiterate a warm welcome to all of you on behalf of us here at AestheticSource. I think it's great that everybody's reaching out to talk to each other and get a dialogue going under these very challenging circumstances. And we know for sure as aesthetic clinicians that many of our patients may well reach out to us for advice in relation to any inflammatory skin conditions that they may have. So we've tried to capture some of the most prevalent ones. So we're going to look in a bit more detail at how chronic or acute sleep deprivation can exacerbate or worsen the visible signs of skin aging. We'll also look at how stress affects existing inflammatory scalp conditions, as well as dermatitis, also look at the inflammatory component of acne and rosacea as well. So to begin with, the first of these that we will look at is essentially how sleep deprivation affects the skin. So I mean, essentially, you know, as we're all aware, sleep is such a fundamental part of obviously our overall well-being and the homeostasis of our bodies. And there's been a lot written about this topic. This is literally just one paper, one of the most recent papers that I've managed to find, which summarises all of the many extrinsic and intrinsic effects as a result of chronic sleep deprivation. But what's happening more at a physiological level is, as we know, that sleep deprivation fundamentally does increase activation of the sympathetic nervous system. And as a result of that, we do see an increased glucocorticoid secretion. And ultimately, that has a big impact on the integrity of the skin barrier. But overall, what we see as far more overarching effects is that we do see detrimental effects in various different skin properties. We see obviously transepidermal water loss, where that may not have even been a concern on an otherwise healthier and more intact skin barrier. We see worsening in appearance or more visible appearance of the pores within skin, a decreased skin tone, loss of hydration, dullness, greater laxity and loss of elasticity at facial areas, and reduced desquamation as well, which can also lead to an overall dullness in the appearance of the skin, and also reduced blood flow as well. But as we said, this, you know, the overarching effects of sleep deprivation can be far more far-reaching. So if we look on the next slide at one such condition which is known to actually worsen, become worse, if you like, through loss of sleep and also through stress, is seborrheic dermatitis. So this is a very, very common fungal type of skin